great period. Now you know. IRA, promoting insurance, protecting the insured.
What has been your greatest challenge as a parent during the ongoing COVID-19 pandemic situation? As we wait for the pandemic to be over at home, COVID-19 has given us an opportunity to reconnect with our children. Join Nakada during Good Morning Kenya Breakfast Show as we discuss positive parenting. Remember, parenting is all about you. Nakada, for a nation free from alcohol and drug abuse.
Welcome back, and thank you so much for staying with us. Now we get to our segment Perspective, where we get to focus on issues that are shaping the news. Now, research shows that the country's per capita water availability is slightly above 600 cubic meters, which is less than the global benchmark of 1,000 cubic meters. It is clear that Kenya is facing a scarcity of access to water supply. How is this affecting efforts to contain the spread of coronavirus, especially at a time when we are all encouraged to keep washing our hands at every available opportunity? And is the habit of washing your hands a dream or a reality, especially for those who live in informal settlements? These are areas that are hugely affected by the lack of water. We'll be talking about those among other issues with my guest who has just joined me, Mr. Anthony Ambugo, who is the CEO, Water Services Providers Association. Thank you so much, sir, for creating time for us tonight.
Thank you too.
All right, so we are having this conversation at a very crucial time and talking about one of the essential, products that are needed. We're talking about water. Right now, we are told to keep washing our hands, especially it's preferred to sanitizing. It's actually the best approach. But then in our country, we still have a very huge challenge in supplying clean water to, residents in different parts of the country. What is your institution, your association doing about this problem?
Thank you very much. I want to put it like this. You've given statistics, but these statistics were done several years ago. In fact, the per capita as it is now is 452 meter cubed per person.
So
it has gone even
lower.
So Kenya is ranked by United Nations as one of the water scarce countries in the world. And having said that, there are many measures being put in place, but our fundamental duty now is to ensure that we keep the taps running with safe, adequate, clean water as contemplated in our Constitution 2010.
Let me take you back a bit, Mr. Ambugo. You've talked about the scarcity of water in our country. How dangerous is that, especially now as we speak with the outbreak of coronavirus? How big of a problem is this?
Now, what I can talk about that is it is dangerous, yes, but there are a lot of coordinated effort to check on this. Like now we are talking of about 88 regulated water utilities in the country. And these serve a populace of around 20 million Kenyans. So that is the population, that is the service area. But within the service area, because of the scarcity of water, we are only able to serve 12 million Kenyans with 1.7 million connections. So I think within our area of jurisdiction, we are doing our best to provide safe, clean, and adequate water. And to put it forward, it has been proven by World Health Organization, and they alluded it in their last report, that provision of safe and clean water plays a very fundamental role in managing outbreak of infectious diseases, including COVID-19. So what we are saying, the safety standards that we are observing now in terms of disinfecting our water, we don't need any other standards. That one is sufficient to handle COVID-19. And that is why the government has put guidelines, proclamations, and directives that you have to wash your hands on running water.
But talk to somebody who is in an area like, mention any of the informal settlements in the country, these are people who on a regular basis still have to walk long distances or even pay more to access clean water. For them, washing your hands regularly, like it has been advised, remains to be a luxury. What is being done to this effect?
I can say we have made very progressive steps as a nation. When it comes to informal settlement in this country, in terms of water service provision, they have already been mapped. And the president has been very unequivocal about that we have to provide free water to the informal settlements. And I think as Water Services Providers Association, we have already gone ahead and we are now implementing the presidential directive. So what I have to say that what has already been put in place in informal settlements, these are people structured with low incomes. You are talking of Kibra, you go to Mombasa, you talk of Bangladesh, you talk for Wachonjo, you go to Nyagacho in Kericho, you go to Siaya Awelo. So these have been mapped, and in fact what we have been doing as water service providers is providing water at a subsidized tariff. We use two-pronged approach because they cannot sustain, most of them, connected water to individual household. We use what we are calling is kiosks, which are subsidized. In fact, it's the cheapest rate, and also we use yard taps. So beyond that now is that we have put mechanisms in place, and we have a lot of stakeholders involved. Just right from the national government. If there is no connectivity, there is no access to water, tanks have been provided by waterworks development agencies and other partners. So what is happening is water is being tracked by using water bowsers to such places. And we are happy the national government has weighed in. There is an emergency fund. As we are doing this will be fully supported from the emergency fund, from the savings that the president has talked about.
Ever since, the first case was reported in our country, other institutions have stepped up their efforts. I don't know what the Water Services Providers Association has done during this COVID-19 outbreak, especially in our country, as efforts that show that you're playing your part and actually walking the talk in helping mitigate the spread of this virus.
Thank you very much. If you look at the role of water services providers as an association, what we do is creating an enabling environment. And we ensure that water service providers at the grassroots, which are fully owned by the county governments, are able to share the information that is coming, because data and information is very important to ensure that the national government is aware of what is happening. So as we are talking now, there is a lot of coordinated effort through Water Services Providers Association engaging the national government, assessing also because of these issues of lockdown, what is the capacity of chemicals that we have in the country? Is it sufficient to take us for the next 3 months? We have done that assessment. We have realized chlorine is a big challenge, because as a nation here, we really need around 150 tons of chlorine every month.
What do we have?
So we have around 60, but the beauty is that we have realized that there are suppliers who have around 400 tons. In high seas, we expect them in 2 or 3 weeks to be here. So there's a margin of safety. So these are the things we are doing. And again, beyond that, as the proclamations and directives have come also from our ministry, is for us to ensure there is coordinated effort to ensure that the different institutions, the water service providers, waterworks development agencies are working together, because this is one of the greatest challenge in our history. And I think it behoves us now to move out of our different places so that we can fight this invisible enemy. So like if we're talking of free water, already we have installed over 2,000 hand washing points. We have mapped out strategic places. You go to baby markets, you go to stages, you go to police station, hospitals, so that people can have this water running. And what we have agreed...
Who is managing these centers?
Yeah, the utilities have arranged, we have staff that are dedicated there in conjunction with also the county government. So we also have a lot of partners, like in Mombasa, in terms of water tracking. There are even individuals who have given their water bowsers to be used. So there's a lot of coordinated effort, though it is not coming out clear.
All right, and the ultimate goal though is to have every Kenyan have this water at their residential areas, in their houses, for instance, which many still, have a challenge, even though you've talked about some efforts that have been put in place to curb this. My question has always been, why would a jerrycan of 20 liters go for between 25 to 30 shillings in Nairobi? For me, that is quite high for the common mwananchi. I don't know what happens in between. Is the issue of cost of accessing clean water part of, some of the issues you're also focusing on in this time?
I want to say here clearly, and for avoidance of doubt, that water service providers provide the cheapest available source of safe and clean water in adequate quantities.
So
the people who provide a jerrycan,
yeah. I want to know what happens in between.
I'll come to it.
Yeah.
The people who provide water at 20 shillings are not water services providers. These are called water vendors.
So what happens in between that would even justify that?
Now, the thing that happens is that, let me come back to our cost. I'll give you that we have a tariff because this is regulated by government.
Yes.
We don't put our own prices. We just give a proposal of our cost, then the regulator comes in, protects consumer interest. 0 to 6,000 liters, that is the lowest band. 6,000 liters is 300 jerrycans of water.
Yeah.
For 20 liters, it is costed at 200 shillings on the lower side.
6,000 liters.
6,000 liters, that is 300 jerrycans of 20 liters. We sell it at 200. So if you convert,
what happens in between?
it is 70 cents. That is piped water. So if it is in an informal settlement kiosk, we sell 2 shillings per 20 liter jerrycan. Now the challenge is those who cannot be able to access directly from now the kiosk, where you have a challenge like in the informal settlement, that is where you have vendors, and at times we may not control it. We don't know their source of water. Those are the people who sell now water expensively. But for water services providers, it is regulated. It remains the cheapest and safe source of clean and safe water in this country.
All right, well said. Now, focusing on the coronavirus global pandemic, so far we have 158 cases in Kenya, and Nairobi County, being among the urban centers that are dealing with a shortage of water, is accounting to 82% of the total number of positive cases of coronavirus. What is the way forward? What is currently in the entry of your association going forward? In the coming days, these are crucial days for our country. Water remains to be one of the essential products that are needed at this time. What is currently some of the issues that you're focusing on?
I think in Nairobi we face a big challenge because if you look at, because the service provider here is Nairobi City Water, the installed capacity of Nairobi Water is 575,000 cubic meters per day. But the demand was 770. It has already now gone beyond 800,000 if you look at the census. So that means that the water that comes into Nairobi, and in fact from the installed capacity of 575,000 cubic meter, Nairobi is able to provide only 525,000 cubic meters.
It is still less.
And again, there is still a challenge because some of this water is lost in form what is called non-revenue water. So, but what is being put in place with what we have at the moment is that already there is a lot of water tracking. The informal settlements have been mapped out. I've just talked to the managing director. The president has issued the directive through the Nairobi Metropolitan, but this is coordinated with the water service providers. And I can tell you that in terms of ensuring that people are able to clean their hands, like in Nairobi alone, Athi Waterworks Development Agency has swung into action the ministry. We have over, I think, 800 hand washing points. And the informal settlement, the vulnerable people, this is where the focus is. Water is being tracked to Korogocho, is being tracked to Kibra, just to ensure. What we can be able to do this is just containment. But what we appeal to each and every Kenyan is to comply with government protocols and directive. And you can see I'm on the forefront. You see I have a mask already. This has been issued this evening.
All right. Is information circulating that customers with outstanding water bills will not be disconnected, courtesy to the economic downturn that has been caused by the spread of coronavirus, true?
Now, the president has been very clear on that, and even the Council of Governors weighed in. The truth is that we are not going to disconnect anybody. But the president has said that for the government to continue giving public services and public good. And what is a public good? If you go under Article 43 of the Constitution, then people have obligations to pay taxes and to pay even for water. So if we are not disconnecting you, that is not a license for you not to pay for water. It's different. So if you are unable to pay for water, you have a contract with the utility and you want the service to continue so that we have sustainability in the COVID period and post-COVID period. And that is why now the clarion call from government is people have to pay their bills. What is very clear, the support is going to focus on people in the informal settlements, particularly, and those ones who are vulnerable.
The vulnerable groups.
And there is a fund. It is not even the water service providers to do that. The president has been very clear. The government, any savings that is coming in is going to meet that. So the idea of free water for everybody is not there. It's very, very clear that the people who are vulnerable, people in the informal settlements, this is the focus, and there is a fund to deal with that.
All right. Thank you so much for your time. And of course, we look forward to seeing how this will pan out in the coming days. I've been talking to Mr. Anthony Ambugo, who is the CEO of Water Services Providers Association, shedding some light on what the association has done as part of their efforts to help in mitigation of the spread of COVID-19. Once again, thank you so much for your time. Now we want to focus on matters business, and we have news for you that Kenyan tea export volume declined by 4 million kilos to register 40.5 million kilos in February compared to the same period last year. According to the latest data from the Agriculture and Food Authority, 37.29 million kilos were sold through the Mombasa tea auction, attracting a reduced average auction price of $2.13 per kilo during the month.
Tea is Kenya's second biggest source of foreign currency earnings after remittances from citizens living abroad. According to the latest report by the Agriculture and Food Authority, despite selling 3.09 million bags more at the Mombasa tea auction in February 2020 at 37.49 million bags compared to a similar period last year, the average auction prices slumped to $2.13 per kg from $2.16 in 2019. Scattered showers and moderate temperatures experienced in the western and rift areas led to an increase of production up to 49.2 million kilos from 31.4 million kilos recorded in the comparative year, with smallholder subsector taking the lead at 19.02 million kilos. Pakistan was the leading export destination for Kenyan tea, having imported 14.6 million kilograms, which accounted for 35% of the total export volume. Other key export destinations for Kenyan tea were Egypt with 8.4 million kilograms, the United Arab Emirates buying 3.75 million kilograms, and UK at 3.36 million kilograms. Emerging markets that recorded significantly higher tea imports from Kenya include Ukraine, Iran, Oman, Belgium, Morocco, Jordan, Myanmar, and Uzbekistan. At the same time, cumulative